We are continuing our roundtable event, our panel discussion, and our panelists include constitutional scholar and former candidate for president Michael Badnarik, and possibly future candidate. Just planting the seeds, Michael, just planting the seeds. Dr. Eliezer Ben-Joseph, certified naturopath, as well as holding a number of degrees that is so long that I don't have the time to go through all of them. And Michael Danforth, senior counsel at Shaw Law in Illinois, who actually quit his job with the Attorney General's office when he started to learn the truth of what was going on, and now devotes himself to using the law to help people, which is quite a concept. All right, panelists, let's talk Obamacare. First, real question is, do you believe the new Congress will repeal Obamacare? Michael Danforth.
Well, Brent, I don't think the new Congress is going to have votes to repeal Obamacare. However, I think that what you will see is the Republicans, because they have control over the House of Representatives and they control the purse, I think you could see a defunding of certain aspects of Obamacare. And without the money, I don't know how it's going to be implemented. I mean, and I think that's why you're going to be seeing a lot of lawsuits also filed by the states, because in essence, Obamacare is for the first time forcing individuals and forcing states to purchase from private companies a insurance product or any type of product. It's in essence in the form of what we would call an unfunded mandate of just astronomical proportions, and forcing healthy individuals, healthy young people to pay far more for health insurance than they otherwise could buy that product on the open market. I mean, I say this because I used to be a vice president with the division of Blue Cross and Blue Shield. I understand the insurance industry. And I tell you, it's going to be disastrous. I have received numerous calls from doctor friends of mine who are just saying, I don't know how we're going to do this. We have enough paperwork already with Medicaid and Medicare that we've got to keep up with. We'll never be able to survive the avalanche of paper we're going to have to churn out now.
Well, do you think that this will be? Do you think that it's more likely that the legislature or the judiciary will manage to somehow dismantle this, if either?
Well, I do think that more than likely, when this does get to the Supreme Court, and I do believe that it will get to the Supreme Court, I believe probably by a 5-4 majority that the courts will strike it down based on the fact that it's overbroad. It's overreaching for the government to actually come in and mandate what a private individual must purchase. Okay, now many states, as you know, do force individuals to buy liability insurance if they are going to drive their automobiles on the public highways for the purposes of not protecting themselves, but for the purposes of protecting somebody that they may hurt in an accident. But this will be the first time that the government has actually said, you as an individual must purchase a product from a private company and have that product priced not utilizing the normal market forces to set the price of that. From an actuarial point of view, look, the government can't do anything the private sector does cheaper. So you're just going to see an astronomical rise in the price of health care if this continues on and does go into effect in 2013, 2014.
Michael Badnarik, and before I toss this part of the question out to you, we had a question from the chat room, Vanessa, who wanted to know if you have heard anything about the newest executive order just signed, something having to do with the Attorney General.
I have not heard about it. If people want to send me an email, I'd be happy to investigate it. But no, that's the first I've heard it.
Okay. All right. Thank you for that. Now, Michael, okay, the same question to you. Do you think the new Congress, there's been a lot of talk. You vote me in and I will vote to repeal Obamacare. Do you think it can happen?
Let me just preface, you planted a seed asking me to run for office. I think you and most of your listeners probably know I will do anything for liberty. Whatever it takes, there is no effort on my part that is too great. But I'm not going to waste my time or your money running in an election that cannot be won. You get hand-counted paper ballots back, and, yeah, there's a strong possibility that I'll get back into politics. As far as Congress repealing or getting rid of Obamacare, no. Again, because as Michael said, the Democrats and Republicans are, two heads of the same monster. They will go through their play acting. They'll probably come up with some clever phrases on television to make us think that they're going to do something, but it's not going to be profound. It's not going to do very much. But I'd ask your listeners, who owns your body? The answer is, duh. Of course I own my own body. Well, if you own your body, then you decide what foods you eat. You decide what liquids you drink. And I guess you're the person to decide what kind of medical care you get. The very first question I got as a presidential candidate was, asking about my position on mandatory vaccinations, which is now coming up again with Obamacare. And because I wasn't a diplomat yet, I didn't know how to answer questions without pissing people off. My answer was, you bring the syringe, I'll bring my 45, we'll see who makes a bigger hole. Nobody's going to inject me with anything, without my approval.
Boy, it just speaks to my heart when I hear you talk like that. We've got a caller, Kevin, calling in from Connecticut. Kevin, welcome to the show. You are on with Michael Badnarik and Michael Danforth and Dr. Eliezer Ben-Joseph and yours truly.
Hey, that's great. How you doing, Brent? This is Kevin in Connecticut. And wanted to just correct you guys. You need to stop calling it Obama. Let's call it what it Obamacide. That's what we should be calling it, because that'll head. That's what we're talking about. That's that Tony show has with it. So just use the Obamacide. I remember one of my early memories as a kid growing up in California was about 5 years old, and my father came home, talked with my mom, and he was talking about how he got medical insurance at his job. And my mother was overjoyed because this was, quote, fringe benefit. Nobody got health care benefit at the job. How did you manage that? And so we've gone from that around 1969 or so to talking about Obamacide. It's really amazing how frog in the water happens with time and time again. I'll hang up the phone and let you guys. Brent, great show.
Thank you. And actually, I just got sent over onto my screen from Michael Danforth a wonderful Thomas Jefferson quote that I have not seen. If people let government decide what foods they eat and what medicines they take, their bodies will soon be in as sorry a state as are the souls of those who live under tyranny. Wow. That's really something. Dr. Eliezer, okay, if we can't repeal it, can we dismantle it? Are there portions of this that we can get rid of or that we can obstruct? Do we have any chance of stopping this abomination of health care?
Well, it's such a technical, question, because the overall Obamacare, I think, is going to be thrown out in the courts, because I do not know in the Constitution where you can mandate a person to buy a private thing from a private company. But one of the things I wanted to correct, Kevin? The death panels, even though I'm not a fan of any of this, there is no real what we call death panels. And let me give you, as a physician, if you have someone on life support system and the guardian wants to talk to the doctor, that is not a covered expense in insurance. So they have to go and do that. So that idea of a guardian being able to talk to the physician about, do we pull the plug, do we not pull the plug, what's the prognosis, that was what was put into the insurance to be able to cover that. So it's not really death panels. What the panels are is determining funds and whether funds will be paid for something. So by proxy, that becomes a death panel. Okay, they would never determine or decide to let someone die, but they might decide that we don't have the funds to cover that $150,000 a day in the ICU. So it changes somewhat in that. I think there are certain provisions of any insurance. I think the only insurance that people really need is catastrophic health insurance. God forbid something happens, you get hit by a car, you fall out of a tree, you fall off the roof, or somebody shoot, whatever, you get paralyzed, you come down with some catastrophic disease. That would be the only thing that would really be an insurance that everybody needs. When I was a child, I remember going to the doctor in the 50s and in the 60s, and you paid your fee. There was no where you would get the intent of having your office visit covered. And I don't know where that ever changed, that people somehow figure that if they want to go to the doctor because they have the sniffles, that should be a covered expense. And I think the whole insurance has become ludicrous as far as how it's happening. I think one of the things that has to be discussed is to allow the free market to occur, and that means for the government to get out of the way and allow any insurance company to go into any state and offer their services. Right now, it's almost monopolies in states because the government will only allow certain insurance companies. So the free market is not deciding. And if the free market was there, we wouldn't need a mandated government insurance at a lower price because the insurance companies themselves would be fighting for your dollars and they would be giving you things at lower prices. Right now, it's a monopoly. So it's kind of a difficult. I do not see Obamacare really coming through. But there are certain things, I would like to see having no pre-existing conditions. I would like to see a portability of insurance, which both parties have been talking about, but I don't see it happening. Well, I do not think this Congress is going to work together at all.
Well, now that raises the question to Michael Danforth, which is there a way to treat this Obamacare, forgive me, Kevin, is there a way to treat Obamacare like a sculpture and chip away at the pieces that are unacceptable and actually leave something that is useful? Is that even a viable way to perhaps go after it?